Well, there have been a lot of things in the St. Gallen, and obviously on the last day of the conference will be the whole voting of the guidelines. More intrigued for me would be some of the local-regional therapy discussions that we had, which essentially all point to the same direction, that we are starting to de-escalate surgical therapy, both in the breast as well now as the axilla, to the point of even omission of sentinel lymph node biopsy in selected patients with low, small-sized tumors like T1 and 0, the majority of which, if you do a sentinel node, you'll find out that the sentinel node was negative. So 2 prospective randomized clinical trials have shown that it doesn't make a difference if you do the sentinel node or not, as far as local recurrence in the axilla. And those patients, of course, may have some issues with systemic therapy, because now we have some new drugs that actually work for node-positive patients, particularly ER-positive, postmenopausal node-positive patients. So we have to balance the escalation of surgical treatment to either escalation of other treatments, such as breast radiotherapy, or systemic therapy escalation, or omitting potentially the systemic therapy, which could be beneficial to the patient. So there's a very fine balance to find how much can you de-escalate the surgical therapy without changing what patients do afterwards, in terms of radiotherapy and also in terms of systemic therapy.